Hello friends, good morning. This is Dr. Mokhtar. Welcome you all to today's lecture on diabetes mellitus. This is the second lecture on diabetes mellitus. I am taking lecture from the textbook of medicine, that is Davidson, and the Davidson is very important for FCPS and MD students. So today we will learn about some boxes from the Davidson. Firstly, we will go how we can diagnose a patient of diabetes mellitus. What is the diagnostic criteria of diabetes mellitus? So we know this is a metabolic disease, and it is there are different types of diabetes mellitus: type 1 diabetes mellitus, type 2 diabetes mellitus. So there are also some stages of diabetes mellitus like pre-diabetes and diabetes. So when we can call it a diabetes mellitus or pre-diabetes. Diabetes mellitus is confirmed either plasma glucose in random sample or 2 hours after a 75-gram glucose load if it is more than 11.1 millimole per liter, that is more than 200 milligram per deciliter, or fasting plasma glucose more than equal to 7 millimole per liter, that is equivalent to 126 milligram per deciliter, or hemoglobin A1C more than 48 millimole per mole. So if a patient is symptomatic and his random blood glucose is more than 11.1 millimole per liter, or patient is symptomatic and 2 hours after breakfast or 75-gram glucose load if it is more than 11.1, or the fasting glucose more than 7 millimole per liter, or hemoglobin A1C greater than 48 millimole per mole, that is equivalent to 6.4, then the patient will be diagnosed as a case of diabetes mellitus. But in the testing, if we find fasting glucose is more than 6.1, more than equal to 6.1, but less than equal to 7 millimole per liter, then we can call it impaired fasting glucose. And if the 2 hours after breakfast or glucose load more than 7.8 but less than 11.1 millimole per liter, or more than 1 then with a normal fasting blood glucose, then we can call it a impaired fasting glucose tolerance, IGT. So in case of hemoglobin A1C, we can tell that hemoglobin A1C from 40 to 47 millimole per mole is indicative of pre-diabetes. That is, hemoglobin A1C greater than equal to 5.6 but less than equal to 6.4, then we can call it a pre-diabetic condition. So this is the diagnosis of diabetes. So there are some preconditions which should be fulfilled before performing a OGTT test. For OGTT test, patient should be unrestricted carbohydrate diet for 3 days at least, and he should be fasted overnight at least 8 hours, and he should be rested for 30 minutes before the test and remain seated for the duration of the test with no smoking. Patient will have to do a test after 2 hours, so during that time, during the 2 hours time, he should be on rest without smoking. And sampling should be taken during the fasting blood glucose and after 75 gram oral glucose, 2 hours after 75 gram oral glucose. So the, if we can fulfill the precondition, then we can perform a OGTT test, that is the oral glucose tolerance test, and based on the test report, we can diagnose a patient diabetic or pre-diabetic. So, in case of the hemoglobin A1C is a very important test nowadays because this gives a overall average value of blood glucose level over a period of almost 3 months. So this is a very good indicator to have to identify diabetic or non-diabetic patient. So now we can tell something about pathogenesis of type 1 diabetes mellitus. So we know there are several types of diabetes mellitus. Firstly, we will go for type 1 diabetes mellitus. For type 1 diabetes mellitus, here there are many factors, some genetic factor, some environmental trigger is there. So main thing is that there will be a complete destruction of beta cell, which results in loss of insulin, and due to lack of insulin, patient develop diabetes mellitus. This is the type 1 diabetes mellitus. So the people have genetic susceptibility to immune dysfunction. There is some antibody mediated beta cell destruction. There may be some antibody in the blood, and there may be some inflammatory cell infiltration in the pancreas, and there may be, so this is how it is not insulin resistance diabetes mellitus. This is actually a beta cell destruction and insulin deficiency diabetes mellitus. So that is called type 1 diabetes mellitus. So this is common in case of young patient who are lean and thin, but there are some exceptions. There are some environmental factor, metabolic, and in case of type 2 diabetes mellitus, actually this is a insulin resistance diabetes mellitus. Insulin resistance diabetes mellitus is type 2 diabetes mellitus. Actually, the sedentary, it occurs in old age people who are obese, who have sedentary lifestyle, who does not take adequate exercise, so who lead a very stressful life. So this causes type 2 diabetes mellitus. In case of type 2 diabetes mellitus, patient develops some sorts of resistance to insulin. So that is very different from the type 1 diabetes mellitus. That's why it is called type 2 diabetes mellitus. This is the etiology. In Davidson 23rd edition, box number 20.9, there is a etiological classification of diabetes mellitus. That is type 1, which is actually immune mediated or idiopathic, type 2, and some other type that is very different from the type 1 and type 2, like genetic defect of beta cell function, genetic defect of insulin action, pancreatic disease, like a patient is having some chronic pancreatitis or malignancy, pancreatic carcinoma, or pancreatectomy, there is operation in the pancreas, or there is iron deposition in the pancreas like hemochromatosis. There are some calcium deposition or fat deposition in the pancreas resulting in fibrocalculus pancreatopathy. So pancreatic disease can lead to some diabetic condition. So this is secondary diabetes due to pancreatic disease. This is not type 1 or type 2. Sometimes some other endocrine disease leads to increased blood glucose level, not due to lack of insulin or insulin resistance. Like growth hormone can lead to increased blood glucose, that is in acromegaly. And in Cushing syndrome, excess steroid can lead to excess glucose. So that is due to Cushing syndrome. All are due to secondary cause. Glucagonoma is a glucagon producing tumor in the pancreas. So increased glucagon production can lead to diabetes mellitus. Pheochromocytoma, we know that is the catecholamines producing tumor causing diabetes. So this is secondary diabetes. Thyroid hormone thyrotoxicosis can lead to secondary diabetes. So there are also some drugs which can cause increased blood glucose and ultimately can have features of diabetes mellitus like glucocorticoid, thiazide diuretics, phenytoin. So there are some genetic conditions like Down syndrome, Klinefelter syndrome, Turner syndrome, Friedreich's ataxia, myotonic dystrophy. These can also lead to diabetes mellitus. Gestational diabetes mellitus is a very important topic in case of internal medicine, where a lady after 20 weeks of pregnancy during the second trimester developed diabetes mellitus. So due to pregnancy, due to loss of circulating hormone in the body, she developed diabetes mellitus. This is called gestational diabetes mellitus. So that is another entity because gestational diabetes mellitus usually needs insulin. So there are very few oral drug available for gestational diabetes mellitus because oral medicine can have some effect on the child. So insulin is best in gestational diabetes mellitus. Another thing is that is the monogenic diabetes mellitus, maturity onset diabetes mellitus of the young, that is called MODY. In MODY, there are some genetic factors associated with this diabetes mellitus. So this is a very different from the type 1 and type 2. And MODY, the MODY type 2, that is GCK gene is mutated. MODY3 is associated with mutation in HNF1 alpha. 1 alpha is 3, 1 beta is 5, and 4 alpha is MODY1. So this can be a very important question, that which gene mutation is responsible for which diabetes. So 1 alpha is 3, 1 beta is 5, and 4 alpha is with 1. 1 alpha is 3, 1 beta is 5, 4 alpha with 1. So we can tell 3 is associated with 1 alpha, 5 is associated with 1 beta, then again come down to first, it is with the 4 alpha. But MODY2 is associated with GCK gene mutation. So this is all about the classification of diabetes mellitus.